Welcome back to part 2 of the 5-part webinar on authentic assessment. This segment will focus on the scale for assessment of family enjoyment within routines, otherwise known as the SAFER. In this section, you will have the opportunity to review the SAFER and focus on your role as an interviewer. In order to participate in this section, please print out the SAFER document and the note-taking form. Although this portion can be done independently, you will have a much richer understanding if you complete this segment in collaboration with other providers. By the end of this section, you will have the opportunity to review the SAFER and reflect on its use as compared to your current practice. You will have the opportunity to see an example of the SAFER and reflect on how you can use this in the context of your work with young children and their families. The SAFER is one of 3 parent interview tools that Part C providers can use to gather information from families. The RBI, the SAFER, and the Everyday Routine section on the IFSP are the 3 ways Part C providers in Maryland can gather information for the family assessment. Each of these practices support having conversations with the people that spend the most time with the child. Let's explore the SAFER. The SAFER can be thought of as the precursor to the RBI. First developed in 2000, Robin McWilliam used this as a means for organizing the information gathered from a primary caregiver, preferably a parent, about a child and how they participated in day-to-day activities. It was this information that he deemed necessary to be acquired in order to shift interventions to routines-based and functional. Over the years, the SAFER has served as a support for an RBI and as an alternative to the RBI. The most recent research has been published on the RBI. However, a SAFER completed with integrity and fidelity can yield strong functional routines information. Before moving on, it is also important to consider the bigger picture, where interviews such as the SAFER fit into an evidence-based model for supporting how children acquire the knowledge and skills, the independence, and the social relationships needed to be successful in their home and community. Over the past 30 years, Robin McWilliam has developed the routines-based model for working with young children with disabilities and their families. This model consists of 17 components organized in 3 categories: intervention planning, providing supports, and the engagement classroom model. The theories behind his work are supported by the DEC recommended practices, the key principles for working with children in natural environments, and the 7 key principles for IEP, documents that were shared with you in part 1 of this webinar. Robin's early work in the 1990s supported a shift from direct therapies for young children to addressing their skills in the context where they learn the best, with the people they spent the most time with, and where there were the most learning opportunities. In an interview in New Zealand, as a rationale for shifting the focus of interventions, Robin stated that much of the work in early interventions centered around playing with toys, a scenario that typically involved a practitioner, a parent, a child, and a toy. He suggested that even if we take the practitioner out of that mix, that this is not typical to everyday family life. Children spend their time in routine activities, meals, diaper changes, hanging out, and going places. Robin's work helps us to identify when and where the learning is occurring, and to help the family see how everyday opportunities are open avenues to promote learning. Intervention planning begins with an eco-map, followed by a review of the routines of the child and family, and finally the development of outcomes for both the child and family. We will not be focusing on the eco-map. However, if you want further information on this practice, you can find it on the Making Access Happen website in the Authentic Assessment section. The routines-based interview has been described as one tool early interventionists use to determine families' needs for resources as well as for the child's skill attainment. It is also a method for giving families the opportunity to make meaningful decisions because it includes families choosing their own outcomes and goals. Because the RBI requires extensive training as well as fidelity measures, there are many Part C providers that have instead used the SAFER. We have worked to support the use of this instrument with fidelity by incorporating philosophies embedded in the RBI. So let's talk about the SAFER. The scale for assessment of family enjoyment within routines is designed to pay attention to the location and timing of caregivers' interactions with children because, according to Dunst et al., there is an increased realization that these routines, rather than the formal service delivery times, are when learning opportunities are available. In a measure in which families report children's functioning in their child's day, the MISER, McWilliam and Youngren present 13 routines that most families participate in daily. The family's satisfaction with the routines helps to provide the interviewer with the family's perception as a measure of their quality of life. The SAFER provides a list of the 13 routines identified in the miser, with an option for additional routines unique to each child and family. Within each routine, there are a variety of prompts for the interviewers to use as a starting point. It is important to know that the questions are there as a guide for the professional and are not intended to be used verbatim. The intent is for the practitioner to have a conversation with the caregiver about what is happening in their day-to-day activities. It is recommended that the practitioner completing the SAFER gather robust information around engagement, independence, and social relationships in at least 3 to 5 routines of the day. Strategies to gather this information during routine activities will be discussed further in Part 4 of the webinar. Let's take a look at the SAFER. If you have not already done so, pause the webinar and print a copy of the SAFER for your review. This activity will take about 15 minutes to complete. Begin by reading page 1 of the SAFER and reflect on the directions presented. Review the document by looking at all the routines identified by Dr. McWilliam. Choose one routine that you want to explore in depth. As you review the routine, record your thoughts to the following questions and be prepared to discuss with your colleagues. What are your initial thoughts as you look at the routine's activities? How do you currently gather this information from caregivers now? And how could using the SAFER enhance your current approach? Write your responses in the activity sheet provided. If you are working with other colleagues, discuss the routines that each of you reviewed. What benefits do you see to using the SAFER to gather information from the primary caregivers? So how do you complete a SAFER? The first step is to introduce the SAFER to the family. Prior to the discussion of the routines, the interviewer reviews the purpose of the meeting by saying something like this. The purpose of today's meeting is to go through your day-to-day activities to find out how your child is participating throughout the day. At the end, we'll have a list of items that you would like to work on. We will go through as many activities as time allows. I will be asking questions around how everyone in your family is participating in these activities. I will also explore how satisfied you are with the way things are going. Do you have any questions before we get started? The next step is the interview. A SAFER discussion with the family can be between 1 and 2 hours. The interviewer should explore a minimum of 3 routines. However, it would be best to get as many as time allows. There are guiding questions on the document as well as typical times of the day. However, it is important to explore unique times for this child and caregiver. Asking about the family's satisfaction of the routine helps you understand the family quality of life. All of this should be done in a conversational manner using active listening strategies. The final step is the recap. The interviewer reviews the concerns mentioned in the home routines to remind the family what has been discussed. The family then chooses their priorities, which will become the outcomes or goals. It is important to determine what routines the priorities impact in order to develop participation-based outcomes. If it is not clear what routines are impacted, then the interviewer can refer back to the SAFER. This next activity allows you the opportunity to see the SAFER used to explore several routines with the parent of a 15-month-old child. As you watch, write down your thoughts on the SAFER note-taking tool. What questions asked provided a great deal of information about the child, the family, and the activity? What questions were missed? In other words, what questions would you have asked during this discussion? Since much of the interview is dependent on personal style, what were nonverbal behaviors that contributed to the discussion, and what nonverbal behaviors took away from the discussion? There are 3 video clips for you to review. You may choose to review as many of the video clips as you would like. Enjoy discovering Bryn and her family. If you are completing this webinar with colleagues, following the video review, have a discussion using the 4 points on the note-taking tool as your focus. Be open to reflect on your current practices in order to make room for something new and exciting. Now that you have seen daily activities reviewed using a SAFER, consider the following feedback from several parents following SAFER discussions. What are your initial thoughts about these comments? What are the possible benefits of families feeling this way after your SAFER discussion? Checklist training is considered the best way to learn a new skill. You have been provided a copy of the SAFER Fidelity Checklist, a tool developed with the support of Dr. Robin McWilliam. This checklist can be used to help learn the practice, ensure consistency of the practice, and provide continuity across all providers. The checklist addresses aspects of the practice that assure each family a quality interview about their activities that will result in functional and meaningful information to support intervention. You have now reached the end of Part 2. Part 3 of the webinar will review the scale for the assessment of teachers' impressions of routines and engagement, the SATIRE, a tool to gather information regarding children's participation in a classroom-based program. Part 3 will follow a similar approach as Part 2 of this webinar.